And if they're unresponsive, do they have a pulse? And from there, we're going to initiate or not initiate CPR based on those injuries that we've talked about in these traumatic types of situations. But we're always going to do what? Deal with the massive hemorrhaging first, because if we don't stop that, what's going to happen? They're just going to bleed out at the end of the day. It's not going to matter if we do airway breathing and circulation. And then from there, you're going to fall right in line with that primary assessment. And we're going to deal with that airway and deal with it aggressively if we need to, especially if they're not breathing appropriately. We talked about some of those underlying causes like tension pneumo or hypoxia. So we have to make sure that this person has adequate ventilation. If not, why not? And what can we do to fix those types of things? In dealing with that airway or with the airway in a traumatic patient, we're definitely going to use the modified jaw thrust instead of the head tail chin lift, because we don't want to manipulate that cervical spine. And from there, we will do what we need to as far as the airway is concerned. Sometimes the OPA will be sufficient. Other times you may need to consider an MPA. I've heard many practitioners say we'd never use an MPA. It might be a basal skull fracture, maybe this, that, and the other. And I think that's individual dependent on what's going on with that patient. I think it's where you need to make that determination. But a lot of times you are able to use that that MPA. What about a gunshot wound victim? We're going to use that person, for instance, they don't have a lower jaw. For whatever reason, they tilted the weapon forward when they went to shoot themselves and they blew their jaw off and they're still breathing. When you get there, two nasal trumpets along with some oxygen within those nasal trumpets may be the best way to ventilate this person, right? You're not going to be able to good seal with a bag valve mask. We'll go back to the ATV, the person, the questions you want to look at when you're dealing with an airway are really two things in a traumatic patient. Do they have a patent airway? It's a simple yes or no. And do we need an adjunct? Again, yes or no. And you need to make that determination rather quickly so we can go ahead and secure that airway. And it may be as simple as I need to go ahead and stick a iGel or a King airway in, which we do consider to be an advanced airway, or do we need to go ahead and intubate at the paramedic level? None of those is wrong. It's just a matter of securing the airway and helping ventilate this patient if needed. All right, let's talk about breathing. When we get into breathing, you've already secured the airway. Once you secure that airway, we are going to go ahead and move straight down to breathing. You put that iGel in, King, MPA, OPA, whatever it may be. You're going to do what? We're going to go ahead and assess breathing. You're looking for that chest equal rise and fall. We're going to make sure that there's no kind of flailed segments that are going on. We'll get into more detail with that in our secondary assessment. But you are going to assess airway to make sure that there is adequate oxygenation, right? You don't want to have that paradoxical movement going on.